Thank you very much. Oh, great. Yeah, my name is Greg Tejan. I'm a co-founder and CEO of Revalia. Up until 2 years ago, I was actually a professor at Yale and decided to throw away my cushy tenure-track job to go full-time in the company. And I did that because my lab's work at Yale taught me that 95% of the time when an organ donor passes away, their organs can't be used for clinical transplant. I was in the Department of Transplant doing research on those organs that couldn't be used. And what we learned was that just because those organs can't be used, and they can't be used because the donor passes away from cancer or fibrosis or all these diseases we don't really understand. And from that work and from my own personal losses and experiences of being there when one of my loved ones took their last breath after lung fibrosis, I can tell you that organs do not have to be transplantable to be transformative. And that's what we're trying to bring to life at Revalia. And we're doing this at a time where the FDA has now said we're phasing out animal models because the track record is pretty terrible, right? And it's just time to evolve beyond that. But our problem is the human systems that we have right now, there's some awesome technologies that are happening. We just heard about some really exciting ways that we're leveraging human cells. But when it comes to Petri dish models, organ on a chip, they're so derivative. They're so far from the clinical patient data that there's this big gap. And the patient data doesn't give us a complete picture. But what an isolated organ does is allow you to integrate that data. Because a donor organ comes with a complete medical history. We can do 3D renderings to get full anatomy. We can bring them to life on perfusion devices for multiple days where we can measure physiologic function. We can do anatomically registered biopsies to do digital pathology and multi-omic analysis. You can use every tool available to us to create an entirely new integrated picture of human disease. And what's unique about this is it becomes a Rosetta Stone that allows us to unlock the existing data that is available in other places. And what we're doing at Revalia is then packaging that into a product platform that we're calling Phase 0 Human Trials that folks can access directly either from a data provider side, so those that can have data that could mix with ours, or those that are drug developers or device developers that want to leverage that Phase 0 trial to go much faster in development in an agile style. And so we're building a software platform that enables that. The tool we call Rio Assist is our toolkit for capturing really high fidelity human data in complex care settings. This has been built over basically a decade of effort at Yale of all the wrong ways to do this. So we figured that out and built a toolkit that then anyone that is gathering data in complex care settings can use, and they can then integrate that data with our human organ data to be able to package that to draw developers into the area of development of relevance to them. So for example, one of the areas we're working is acute kidney injury, where we can take clinical data, mix that with our ability to do an insult to a kidney in real time, and then use that to attract developers to that space. And the way that we do that is to this next side of the platform we're developing called Rio Insight. And the way to think about this is basically being able to sit in the comfort of your home if you're a developer, be able to design and initiate a way better clinical trial within minutes. And having worked in clinical trials at Yale, I can tell you it is not usually a minutes-long experience to initiate. And beyond being able to move fast, you can get data that you've never been able to get before. So this is just one example of the kind of work that a Phase 0 trial can unlock. So what you're seeing is a human lung that's being injected directly with a drug into a tumor that is low enough density that you can get a really nice, clean, uniform distribution, which is exactly what we want. And we haven't been able to actually model this very well before because the animal models just don't replicate tumor density and size and shape properties. And that's a huge issue because it doesn't always go so perfectly as I just showed you. This is an example of a large B-cell lymphoma that infiltrated that is so dense that the drug that's being directly injected in, it can't get into the tumor and it goes right back out in the chest cavity. Prior to the Phase 0 trial, the only way we would have known this is because of a failed clinical trial result. We can't innovate unless we can see and learn from our failures without people dying. And that's what this platform allows you to do. So I'll just finish by sharing some of the traction. So we've been able to raise some excellent funding from Connecticut Innovation's been a great partner for us, but our seed round was led by two great Silicon Valley funds, America's Frontier Fund and Sierra Ventures. We were revenue generating from day one and have had multiple customers that we can build this around. We're also now adding multiple healthcare providers to the platform to help enrich their data and further drive the platform. Generated revenue of a little over $2 million last year, which was 4x growth over the year before. And excited to share, it's not fully public yet, but we've just landed an 8-figure contract that's going to make that number scale up even further and expand our ability to honor all these incredible gifts of organs as we work to revolutionize drug development. I'll leave you with the fantastic team that we've assembled, and thank you all for your attention.